Over time, a proven remedy for many diseases, salt-based dressings, baths, and washes, has been forgotten. Salt is not profitable, so you will not find any advertisements for this effective remedy on TV. Of course, how to fight the usual cheap salt with the big pharmaceutical companies. But in difficult times, when you need an effective and simple remedy, salt helps you literally survive. The most common table salt has a therapeutic effect. But English salt, also called magnesia, can have a similar effect. At one time it was very popular in England. Salt is used both for ingestion and as a means for external use. In the first case, it is very important to observe the dosage, because an excess of salt in food can be harmful. Compresses, salt baths, nasopharyngeal solution, face rubs for wrinkles are all effective recipes. In the past, military medics used saline to heal wounds when medicine was in short supply. Imagine a soldier after a wound. The wounds are torn, dirty, and there is a high risk of infection. How do you quickly treat all the edges of a laceration in a field tent? Military doctors abundantly soaked a large gauze bandage in a salt solution and applied it to the wounded area. After 3 to 4 days, pus would stop accumulating in the wounds and they would get clean. The tissues turned from burgundy to pink. Secondary symptoms also disappeared. Temperature dropped, fever stopped. All this indicated one thing: the infection was leaving the body. After 5 to 6 days, the wounds were healing. The use of saline solution has great potential. Many cases have been described in which such dressings have cured diseases of varying complexity, from simple caries to a tumor at the initial stage. Burns, cholecystitis, nephritis, chronic appendicitis, rheumatic heart disease, consequences of inflammatory processes in the lungs, joint rheumatism, osteomyelitis, abscesses after injections, all these diseases recede when salt compresses or dressings are applied. The treatment is based on one simple property of salt: it is hygroscopic. In other words, salt draws out fluid, excess water, lymph, pus, but without touching red blood cells, white blood cells, and living cells of the tissues themselves. Together with excess fluid, bacteria and other pathogens are removed from the diseased area. It is easier to show how salt works with simple examples. You have been prescribed a course of medication intramuscularly. After a few days, there is a bump on the injection site. If it is not treated in any way, at best it will hurt a lot and persistently, at worst it will form an abscess with pus inside. In all hospitals, they continue to make compresses with magnesia or table salt on injection bumps. They very quickly, in 2 to 3 days, dissolve the bump and take away the pain. It is all about the ability of salt to draw out fluid along with pathogenic microflora. In order for the salt dressings to work well, you need to follow a few basic rules. The salt solution should be concentrated, but no more than 10%. If the salt concentration is higher, capillary destruction may occur in the area where the compress is applied. Use only natural cotton or linen cloth folded in 4 layers. The best material is gauze or bandage, which should be folded 8 times. When diluting the salt, use hot water to make the solution warm as well. Squeeze out the cloth before applying the compress. Secure the dressing with a bandage or adhesive tape. At the first symptoms of a cold or flu, as well as a headache, you should start applying compresses on the forehead and the back of the head. A circular bandage will also help with a runny nose. The congestion will go away in 1 to 1.5 hours. If severe migraines torment, it is better to leave the bandage on the head for the whole night. If you missed the first day of the cold, and you have already begun to cough, it is worth to put a circular bandage not only on the head, but also on the back. A compress for the back should be made of 2 layers of towel soaked in saline solution and 2 layers of dry cloth. If you have a cold or flu, the bandage should be left on all night. The treatment will take 4 to 5 days. Even if you felt better earlier, it is worth completing the course of procedures. It is not difficult to prepare a compress. First, prepare a 10% solution. You will need to add to 1 liter of boiled water 100 grams of table salt. If you do not have scales, it is about 3 tablespoons. Make sure that after stirring the salt is completely dissolved. The water will have a white cloudy tint. This is normal. It is more convenient to make the solution in a pot or a basin because this way it will be easier to soak the cloth. If you take gauze for a compress, then fold it into 8 layers and soak it in the solution for 1 minute. A thicker cotton cloth should be folded in 4 layers and soaked a little longer. Squeeze the compress slightly and spread it on your back. Wrap it around your forehead and the back of your head, or place it on another sore spot. Secure the compress with a bandage and put a natural cloth on top, preferably wool, to keep it warm. With such compresses you can sleep all night, and in the morning remove the bits. But if you feel that you are sick with the flu or a cold, you do not need to wait until the evening. Of course, overnight compresses will help not to get sicker and recover sooner, but already at the first signs of a cold you can start to do the washing of the nasopharynx with a saline solution. Saline solution in the right concentration is very similar to the pharmacy saline solution. Therefore, it is absolutely safe for mucous membranes and has no contraindications. The saline solution washes mucus out of the nasopharynx, at the same time removing germs and preventing the formation of a bacterial focus. The solution relieves swollen mucous membranes, disinfects the nasal passages, and removes inflammation. The procedure will help quickly get rid of nasal congestion without the use of vasoconstrictor drops. The recipe for the solution is simple. For an adult, add 1 teaspoon of salt per glass of warm boiled water. For a child, reduce the salt concentration by half. Additionally, you can add a spoonful of soda or a drop of iodine. At the first symptoms of colds, rinse your nose 3 to 4 times a day. You can do this with a teapot, syringe, or syringe without needle. The solution should pass from one nostril to the other. Alternatively, pour the saline solution into a saucer, clamp one nostril with your finger and draw in the liquid with the other nostril. When the liquid enters your throat, don't swallow it, but spit it out.